Except you're muted. So welcome to everyone who's already on. It's nice of you guys to all join in. I'm Cian Lutfi. I'm one of the APDs here at Baystate, and I'm just going to be here in the background helping out as I can with any advising questions that might come up or residency questions that come up separate from EMS and disaster. And I'm going to let these guys introduce themselves, who are all from our division of EMS and disaster. So Wook, why don't you get us started?
Yeah, hi everybody. I'm not looking at you because I'm watching the road, so just so you know what's going on there. I'm Wook Beltran. I'm actually an emergency medicine and EMS medicine board certified and trained physician. Been in the EMS now for probably, someone just reminded me, it's been about 33 years. So I've been doing it for a little bit and have remained active with it for that whole time. Came to Baystate back in 2015, been here for over 5 years. And the division has grown slowly, but wonderfully. We've got another EMS physician, I believe Dr. Alex Zozula is on. He's also one of our EMS physicians. We've got some EMS coordinators. Aaron Mark is our senior EMS coordinator. We have Nathan Stanaway who's on, who's also, I don't know what we're going to define your role here, Nate, but however, whatever title you want to use. He's also the one that's the icebreaker. He likes to get on the radio or on the audio system and test it out. So he's the one that was testing it earlier. He's also a geek, as am I. That's it in a nutshell. Just as another thing, I have worked in law enforcement for multiple years. I've got over 10 years experience, some of it full-time as a law enforcement officer. I've been part of the Urban Search and Rescue Team, Federal, MATF1, did that for 2 years. Also, have been involved with NDMS since about 2007, if I remember correctly, and am currently now under NDMS, and not in a DMAT team, but under the Trauma Critical Care Team. Did 4 deployments this year because of COVID. I've actually seen some very interesting things related to that as well. I've had the opportunity to set up some systems, hospital systems dealing with disasters and surges, as well as when I worked at another place, had the pleasure of responding to a 110-car accident on an interstate in the middle of winter. So it provided a lot of opportunities and discussion points from that event as well. So really am passionate and feel very lucky to be able to participate and help people in that role. So that's the show. At some point, I do want to make sure we share my contact information. Happy to talk to any of you offline if you do have questions later on. And I'll turn it back to Cian to pick whoever she wants. I don't know if it's Alex, Aaron, or Nate to kind of introduce themselves.
Alex, why don't you go next? And what I will do, just for all the students, do go ahead and put your questions in the chat, and I will put everyone's contact information in the chat for you guys, just to help keep it clear and you're not all trying to write random things down.
Sure. Welcome, everybody. My name is Alex. I'm one of the other EMS docs here. So currently there are 3 of us, although Seth, who's on here, is going to be our 4th come July, I think. So I started here at Baystate a little over a year ago, July 2019. Did my EMS fellowship in Cincinnati. Been kind of migrating around the country, but just to give you a little bit more background on kind of the way things are structured. So Wook is the division chief. I am responsible for the EMS agencies up in Franklin County. So 2 counties north of Hamden County where Baystate is located. And each of our community hospitals has, or will have when Seth starts here, an EMS physician who's responsible for medical direction there. So I have Baystate Franklin, Ken Knowles, who is the 2nd EMS doc in the division, has Baystate Wing, which is the Eastern Baystate Community Hospital, as well as the freestanding emergency department out there, Baystate Mary Lane. And Seth is going to be taking over for Baystate Noble, which is a little bit west of the main Baystate Hospital. And then our fearless leader, Wook, is responsible for stuff down at the main campus primarily, but oversees everybody.
Awesome. Erin, can you talk about what your role is?
Absolutely. Good afternoon. Thanks for the invite. So I am the Senior EMS and Pre-Hospital Coordinator with Baystate Health. My primary focus is quality improvement for all of our EMS agencies. I think we have about total 100 ALS, BLS, first responder, and EMD, which is emergency medical dispatch agencies throughout all of Western Massachusetts. We have direct medical oversight for all of them. I started in EMS in 2006, right out of high school, and obtained my paramedic certification in 2009. Fast forward a couple years, I began doing a lot of the quality improvement and quality assurance for the agency that I was working for at the time, and then became heavily involved with EMS education for the paramedic programs. I love all aspects of EMS, specifically education, and one of my big passions is cardiac arrest management pre-hospital. I also am dispatch certified, have been deployed on one deployment to Harvey, but have been a member of the FEMA response team for a few years now, and am certified in critical incident stress management for our EMS providers as well.
And rounding us out is going to be Nate.
Hi guys, Nate Stanaway. I also am a paramedic by training clinically. Recently finished up some other things. I also have training in business and economics. And so I sort of support the division when it comes to the financial side of things, the business side of things. You know, how can we translate what is an obvious clinical and operational need from the medicine side into something that we can you know, work with our senior leadership to justify and make it work. I also do a lot with day-to-day operations for interfacility transport. So we have a number of hospitals, and moving patients around those hospitals, between those hospitals and out of the system can be relatively complex sometimes. So I also kind of oversee that. I also oversee some relationships we have with an air medical transport provider and with a mobile urgent care provider called Dispatch Health, which is sort of an urgent care on wheels that we can send out to get to patients when they can't get to us, or it doesn't make sense for them to get to us. And then I kind of do lots of other projects and things. I would sort of define myself as a bit of a fixer for some of us.
I think you've been that for a lot of us. Thank you, Nate. Next is Seth Kelly, who is about to join our group, and he will tell you a little bit about what he's already done and what he's expecting to do.
Seth, you're on mute.
Seth may have had to step away, which is not a problem. And then we have one of our residents on with us, Matt Goebel.
So I guess you just kind of want me to give the one-liner.
Tell him about yourself. You have a lot of interesting things in your background there.
I guess interesting is one word for it. I would call it ADD, but so my name's Matt. I'm a second year at Baystate. I got, before medical school, I got involved in EMS starting in like 2008, then went on to become a paramedic in like 2010. That sounds right. And then in around that time, decided to go to med school. Have continued to be interested in EMS and planning on doing an EMS fellowship after residency. And I've gotten to get involved with the EMS guys here, both in like research capacity as well as a second year. We have the opportunity to do, like, instead of having a 1 month elective of like intensive things, you have like a longitudinal elective where you work like one less shift per month. And then you get to be like an associate or an assistant medical director for one of the agencies in the area. So I work with the Wilbraham Fire Department. just over the way from here. And I help them with their QI and some education stuff, and then do some ride-along time with them. Yeah.
Yeah, and that's actually one of the most innovative things that our EMS division has come up with, which is to allow those residents who are most interested in EMS and disaster to actually do longitudinal electives rather than doing a concentrated month in which they would only get a little bit of experience. Actually doing that longitudinal allows for a lot more education within this realm. And I think it's amazing. And as you guys go forward and have your questions, one of the things to always think, obviously talk about our personal experiences and do this division here at Baystate. You want to think about, what do I want to ask when I'm on interviews with programs and looking at programs that will help me to say whether or not they're going to give me the experience that I really want to get. And
yeah, and I was just going to say, kind of like the goal, and when I was talking like at the beginning of the rotation with Wook and kind of setting it up, it's the goal is for us to be kind of like a sub fellow, like the same way that when you guys are doing your 4th year rotations, that you're trying to be like a sub intern, like just below intern. So they're trying to get us to function as like just below fellow. So I think it's really cool. I enjoy it.
And while labeled as Alex, duplicating himself very, very impressively, is Sam Broder, who's also one of our residents, who has a lot of pre-hospital experience and apparently can get away for this one moment. So he's going to introduce himself too.
Hi, everybody. I was able to step away from shift so I could come in and say hello. We have some familiar faces, and I'm just scrolling through. I came here to Baystate with a strong interest in EMS and figuring out how that would kind of shape my career moving forward. And it's been a lot of fun. And I think you've probably talked a little bit about the intern EMS rotation. But essentially that allows you some flexibility and some exposure to work with the medics in Springfield and to see dispatch and ride with supervisors. So even if you're not particularly interested or have a lot of experience with EMS, that will give you some exposure. And then, like I think I just heard Matt talking about, you can longitudinally schedule your 2nd and 3rd year rotations to work with the regional medical directors for a local service. And that is a ton of fun. And there's also some flexibility to work with services that either match your experience or can fill in areas that you don't have experience. For example, I worked mostly urban EMS before medical school, and I'm really enjoying now being the assistant to the assistant medical director for a rural service. And it's a lot of fun. And I think some of the highlights of my days are when the medics come in and give me handoff on the patients, and they know my name and they want to ask a question, and then I'll get some emails saying, "Hey, Sam," and I love that they call me by my first name. Just curious about this, or I'll get a text message with an EKG, and it allows for a lot of continuity and a lot of interpersonal development. And then you get to see the behind the scenes. I get to see what Alex deals with, and continuous quality improvement and protocol issues. And it's fun, and it's a new experience to be the go-between between a service and other providers that might send you an email. Hey, curious why ketamine was given in this call, or curious about this. So I think we're fortunate that we have a lot of services in the region. There's a lot of opportunity to do urban, to do suburban, to do rural. And I think the experience is only going to strengthen as our fellowship gets off the ground. But I'm very happy to be involved, and it's really, it's kind of like crazy that people get paid for this because it's so much fun.
Thank you so much, Sam. Hopefully we'll see how much longer you get to be with us, but thanks for giving the overview and your experience. I love that Sam is now my resident because I knew him as a paramedic for years and years. And it's just awesome to see people continue to grow in their fields of interest. Let's throw it back to Wook so that he can give a little more info about how we sort of approach EMS and disaster here at Baystate and what experiences we try to give our residents.
Yeah, well, thanks for that. The experience here at Baystate has been slowly growing through the efforts of everybody that's on this call from our division: Alex, Nate, Aaron, Ken Knowles, who wasn't able to make it today. He's one of our other EMS physicians, as well as our our residents. One of the things that we did when we came on board and as we developed was we said, you know, we really want to look and see what kind of experience we can give as far as disaster and EMS with our residents. And one of the interesting parts of this was talking with Dr. Kellogg, Dr. Osborne, Dr. Lupfi is basically, well, what about doing like a disaster day where we do a simulation? And what we have been doing typically, except because of COVID, is allowing, providing opportunity for all the residents to participate in a day over at Six Flags, where we take one of their areas, and that's our venue, and we set up a simulation with moulage, sounds, bring in the ambulances. We brought in the helicopter. And what we typically have done in the past is run stations in the morning and in the afternoon run through simulations with 18 to 20 moulage patients to mimic a large-scale event. And there's been different ways we've done this, whether it's an explosion or something like that. And I think that's been generally well received, and we've been refining it further and further as we get more into it and get the feedback from the residents. We allow the students to participate as well. Again, unfortunately this year, because of restrictions within the state and just common sense safety issues, we weren't able to do this, but we anticipate on doing this in the future. The other thing that's been kind of interesting is we've been able to connect with some of our residents, and students have asked me about how do I connect, because I have an interest in, for instance, urban search and rescue. How do I do that? And because of our connections with that particular entity, we've been able to give them the opportunity when they're available to attend some of the training that may go on there. There's a regional team that's developing for not only hazmat, but also for some other specialties, including tactical and stuff like that, that allows us to incorporate the residents into that as able. And some of that is really dependent upon the resident schedule, but it's been a good opportunity. And having folks like Dr. Knowles, Dr. Zozula, Aaron Marked, and Nathan available, we're able to give folks a really good experience on what EMS is like, not just the spectrum of riding in the ambulance or riding with the supervisor of an ambulance service, but also what that entails. When you're riding along, it's not just about clinical care, but it's also identifying system opportunities with EMS. And we take that and we plug that into our education, and we've identified there's certain procedures that people want more practice with. We offer that to the paramedics. The residents will help us with this as they're available. People like Matt Shapiro is another one of our residents who is doing the longitudinal experience. People like Matt Goebel, people like Sam Broder, and we're able to provide better quality care, not only to our patients, but education to the paramedics. But it's also a good experience for those who opt to do that, because then they get to see the whole spectrum of how the protocols are developed, how we interface, systems integration, which is a big part of what the EMS fellowship and EMS physicians do, is integration between police, fire. You heard Aaron Marks talking about dispatch. Those are all parts of what we deal with, and it's an important part of the spectrum of care. So there's opportunities galore here to do that. And I've had people actually reach out to me, including Matt Shapiro, and I think Matt Goebel may have reached out. Hey, how can I do helicopter? How do I connect with people with helicopter? Maybe we can't do it here, maybe we can, but I just want to talk to some people who are doing helicopter and see what that's like, that kind of stuff. So we have a lot of connections in the out-of-hospital or pre-hospital environment to various elements of this, including public health, on how we integrate those various components of the pre-hospital care.
And I think Wook is not fully, he's only been here 5 years, and he has completely revolutionized how we educate around and get our residents and students involved in EMS and disaster. Years ago, it was essentially a rotation where you did a few ride-alongs, and that was the extent of what the experience was. And I have to say that our residents really didn't get that full spectrum picture that they're now able to get, and didn't also get to explore. Ken Knowles was a resident here and knew this was what he wanted to do, but really didn't get to have that experience during residency to feel more confident in his fellowship decision. And I'm so glad that it was right for him. But I'm also really glad that now we're able to give so much more experience during residency so that you guys get to explore and you can make that decision for or against fellowship with a little bit more behind and confidence in that decision. Wook, do you want to real quick just cover our fellowship in EMS is under development right now. Do you want to talk a little bit about that?
Sure, happy to talk about it. So I was part of a couple of, well, one other system, well, 2 systems in their development of an EMS fellowship. So it was a natural fit because of, like Dr. Zozula had mentioned, we have all types of services. We don't just have a city service. We've got urban, rural, volunteer. We've got the whole spectrum. So that was kind of a great place for us to look at doing an EMS fellowship so that the fellows would get a wide and broad-based experience. So we've applied for a fellowship through the ACGME, and one of the things that we're looking at, it's still a work in progress. We're waiting to hear back from the ACGME. There's a second process that's running in parallel with dealing with the budget part of it. But there's a lot of support for it within the Baystate health system, and I think it's being recognized through a lot of the work that Nate's done, especially with interfacility transfers, of what an EMS physician could bring to the table, and training EMS physicians could do for the Baystate Health. So we're currently looking at that, and the plan is for it to be a fellowship that's not only academic, meaning you're doing continuous quality improvement. You're not only riding in the field, but you're in your own vehicle. So you've got some independent capability with the rest of the EMS faculty being available either to respond or available by phone on calls. Because the EMS fellowship is really not just doing QI, it's not just education, but it's actually performing a lot of these same emergency procedures in the field as we might do in the emergency department. And that's one of the reasons that this became a subspecialty, because doing an intubation in an ED, believe it or not, is considered a controlled environment in the EMS world, because we may be doing it in a person who's trapped in a vehicle and upside down. So we have to be able to manage that airway and manage that patient's care. So we've got that opportunity being created. We're working very diligently to try to get that fellowship here, and we anticipate hopefully getting that within a couple of years, but I'm making no promises, but we are very interested, and there is support for it throughout the system.
And just so students and applicants here, there are non-accredited fellowships, and that's what most of the fellowships in emergency medicine are. And then there are a few that are accredited through ACGME, and so that's what EMS is. And that's a much longer and more complicated process, as you might imagine, to go through than to start up, say, an ultrasound or a medical education fellowship, both of which are non-accredited. And so that's part of why it does take a little time. But Wook and the team have been doing an amazing job of getting that off the ground. We have a little over half the time left. You guys have gotten a lot of info all up front and many, many acronyms, which we will keep throwing out. What we'd love to do is actually answer some of your questions and get you the information you need to help you in your application process for residency to choose the spot that's going to be right for you. What questions do you guys have? So we have a question, which is really happy that we're taking the time to be with you, and you're very, very welcome. But what opportunities exist for involvement at the regional or state level? Who wants to tackle that?
Wook should tackle that. He is the state Region 1 medical director as well.
Yeah, thanks, Nate. I hear that bus backing up again. So as Nate had indicated, I am the Region 1 medical director, which is basically hour west of Worcester all the way to New York. So I am the regional EMS medical director for the state on that. So there's absolutely opportunity for people to participate. It may not be as exciting, or maybe it is. It depends on your interest and involvement in that. One of the things that I do as a regional EMS medical director is I attend what's called the Medical Services Committee. And that's the entity or the body that helps develop and provide feedback to OEMS, the Office of Emergency Medical Services in the Commonwealth of Massachusetts, for protocol development. So if we have a resident or an attending or a fellow that's interested in developing a new protocol or refining one, we absolutely encourage that. And I've had people, paramedics, nurses even, and one of our attendings that asked me to submit either a new or an addended protocol and bring it forward to the state, which I've been happy to do. So that is something that is absolutely an opportunity to get involved at the state level. And at the regional level, there's opportunities to participate in the EMS Regional Council meeting if you're interested in attending. Sam Broder, is he still on the line? I can't tell. I'm not looking down right now. Sam, you on? Sam,
he's on mute. Alex, aka Sam, you're on mute.
Okay. Well, I was just going to say, because I don't know if Sam's attended many of the regional council meetings, but that is available to the residents and will be available to the fellows. Fellows probably more of a requirement, so they get to see how these systems and processes work, as well as the personalities. You have different agencies within Western Mass, some of which are fires-based, some of which are private, some of which are volunteer, some of which are municipal, actually. So it does provide a broad swath of experience regionally and state, and you can get involved or uninvolved as much as you're interested. Go ahead, Nate.
Yeah, I want to jump in to kind of provide some context, hopefully. Who here is not from Massachusetts? Hands, not from Massachusetts. Oh yeah, sorry, me too. EMS exists at the state level and many different sort of flavors across the country. In Massachusetts, protocols or guidelines, however you want to refer to them, are set at the state level. In some states, you have a set of state, optional protocols, but the protocols are set in each organization by the medical director. So in this state, you're the medical director, but the protocols are pretty well set by the state. There are optional protocols in the that you can say, yes, I want to do or not do. And so it kind of gives you a little bit of options to have some variability at the organization level, but it's really kind of set at the state level. So the involvement in those organizations is pretty important. So just some context there.
Yeah, and actually, Nate, that's a real good point. An important point, because some states are different. Some states, like Texas, it is purely based upon that one medical director, and he or she determines what the protocols are like and what EMS can do, versus Massachusetts and North Carolina, which are very much based on a state protocol, Pennsylvania too, and options. So to Nate's point, that's going to vary how EMS is represented and how the processes work. To get changes within the protocols, it's very much a state-based type of thing, and that's where Nate is making the great point of we have to be very involved in that.
So one place where I've been able to be involved in the regional level is on the critical incident stress management team, which I joined a couple of years ago when I came here as a resident. And I think it's a good example of you can kind of follow your interests, where every couple of weeks I go out to a fire department and I talk about critical incident stress management, and I actually respond when the team is activated. Of course, this all needs to be compliant with hour restrictions and that sort of thing, but that's a fun opportunity if that's your interest. And then I've also been able to be involved in the Regional Educational Center up in the Franklin County area, which is a great opportunity to teach and do ACLS and do PALS and do PHTLS and actually be in a room with the medics who love asking questions, and they want to, you know, hear about follow-up cases, and they want to hear about different types of STEMIs, and they love having a doctor in the room. It's really very rewarding.
Great. And Hayden had a question in regards to disaster medicine and FEMA as to whether most EM trained physicians are able to volunteer in these roles, or do they need to have a plan for pursuing a fellowship to get involved?
So great question. And I think I'll take that one if that's okay with everybody. Feel free to chip in any of the other folks as well. So actually, and I got involved in NDMS when I was a resident. It took, because it's federal government, that's all I'm going to say, it took almost 4 years for them to get everything processed. When you're involved with the NDMS, which is under HHS, Health and Human Services, it actually, you're an intermittent federal employee. So when I go on these federal deployments, I'm actually paid as a federal employee. Now as an attending, it's actually falls under USERA if anybody's military on here. So if I get activated, I am activated. I am an asset that's owned by the federal government. It basically allows me to go, and my workplace, Baystate's never resisted it, but my workplace can't do anything about it because I've been activated. So it's like the National Guard. You go out to that. You absolutely have the ability as an EM resident, depending on how involved your program is. So you may have the ability to tie in with that if your residency program has knowledge or works with people that work at that particular team. So that's absolutely something that many places have, not all, but many places have. And so you can get involved in that way. And as a resident and a fellow, you absolutely could get involved. There have to be jobs available, though, to be deployed. And that's one of the things that's kind of interesting is that if you wanted to go on deployments, you have to apply to be part of that team. Right now, we've been on a hiring freeze for 6 years. We are so short-staffed, we've lost over half of our people within NDMS due to retirements and because of more stringent requirements on deployments that, you know, you can't be on a CPAP machine because you may be going to an austere environment. Or if you're on a CPAP machine, you're not going to be deployable to many of the calls. So they're trying to upstaff. And we're in the process of doing a bunch of hiring right now at the federal level. So no matter where you go, I think you'll have the option. It's just you need to have ties with people that know people on the teams.
And I will say that our program director also has served on DMAT teams, and that is something that was really important to him. Most employers that you'll have within emergency medicine are going to support members that are interested taking the time, but it does mean that you have to have a group that you work with that are willing to fill in, because if Wook gets called up, that means that other people are taking his shifts, and you know, you just have to have a group that is willing to do that, and most are. I also know people who we obviously have a lot of people that do global health and separately do disaster. And there are members who simply will time themselves sort of like to actually work extra shifts throughout the year in order to sort of have a set month that they have off, and they sort of respond to wherever in the world disasters are going on. And they sort of time it to where they know there are more likely to be some natural disasters, especially in country. So you really do have a lot of options, and different people, both in community and academic EM, have found different ways. I think if this is something you want to pursue, you are capable of doing that. What the fellowship's going to give you is a much deeper background of how to actually order this, how to respond, and a broader experience that you can bring to your next position. But it doesn't mean that you have to be in a fellowship in order to be able to serve. So next up were some questions about getting involved in helicopters and whether or not Lifestar or Lifelight are interested in working with residents.
Alex, you can speak up too, because I know you like to be quiet on this, but there are potential opportunities. I'm going to be, it really depends on the program. I'm not hemming and hawing. I'm trying to be careful with this. So if it's something you want to do, you can probably get involved. It's not a mandatory thing. There were programs before that used to make flight mandatory. And because of several incidents where the aircraft had a hard landing or a very, very hard landing, that is no longer a requirement. As far as involvement here, it also depends on insurance too. Because as a resident, if you're going on board and you want to do practice medicine, your residency program has to insure you no matter what state you're in. So most of these helicopters, for instance, in Massachusetts, goes down to Rhode Island, goes down to Connecticut, goes up to Vermont, goes out to New York, goes out to New Hampshire, goes out to Maine. So you've got to make sure that your residency program has insurance to cover that. And most programs are self-insured, but if they're not, there may be barriers to that. Now, putting in that context, here, I think there's been some challenges because of the insurability across the different states has been a challenge. So having the ability to ride in a helicopter and provide patient care has been limited, very limited. However, assisting with quality improvement reviews and education to the helicopter is absolutely something that's possible. Additionally, here we are in the process of developing a critical care transport team, of which Dr. Zozula, Alex, I'm going to let you talk in a sec, is part of, and so there's the potential to be involved with that as well. So just to put it in that context, I hope that helps. Alex, do you want to talk about the critical care briefly?
Sure. So this is a project that got a little bit delayed by COVID, but hopefully will get up and running in the near future. I would hope before any of you started, but we were looking, because there's not really any ground critical care transport assets in this area. You either have to go by an ALS, paramedic basic staff truck, or a helicopter. Baystate was looking into developing a 24/7 staff critical care transport unit to be stationed at the main Baystate campus to go out to primarily the community Baystate facilities, but really any facility in the area that is interested in the transport, and also to do the occasional transport from Baystate to Boston or a different tertiary center where they have sub specialization. So this is going to be a program with a nurse, medic, driver who's an EMT model, but certainly there would be room for residents to do shifts along with that if they're interested, going out and doing these critical care transports. It's much easier on a ground unit because there's usually excess space for another body, whereas depending on the helicopter program, they may or may not be at max capacity weight-wise already.
And also, it may not fly because of weather.
Yeah, and it does snow in Massachusetts.
I also just want to, and Alex made this point in the chat, which I think is really important, whatever experiences you're sort of adding in, especially going on a HEMS unit, that still has to meet your hours requirements for your residency. And so that's another reason that I think a number of residencies have moved sort of away from having their residents on HEMS. And the last piece is just realize that what role you're able to play can also be curtailed. And so I know from residents that had this experience was like that they had these like 12-hour sort of on-call flight times, and then like the role they were playing when they went up was very, very limited, much more limited than when they were in their department. And so I think a lot of residencies haven't seen the educational value come through from having their residents on, and that's part of why you'll see that over time fewer programs are actually having this as a part of their education.
This is,
and just to
go ahead. No, you
go.
go.
I was just going to make the point. We have a lot of contacts within our division. So if you have an interest, even if it's not something we've done before, we probably have contacts to be involved in all sorts of stuff. For example, Mass Maritime, we have connections there. So if you have an interest in maritime medicine on a boat or a ship, we absolutely have that option. I've got actually some contacts there, and that person in charge of that medical director, good guy, great guy actually, And he's very interested in having residents and fellows involved in that. And if there's a resident that's interested, we absolutely would support that. So, you know, just to give you some perspective, we have the ability to support almost everything if somebody has an interest. So go ahead, Nate, sorry.
No, yeah, those are good points. Going back to the ground thing, so the air medical thing, the short answer, you can do a ride along. It's easy to get you set up with a ride along. If you're just interested in riding along as an observer, that's something that's relatively easy to do. If you're interested in practicing medicine on the aircraft, that's a different story. But to go kind of to the ground CCT program, it will be an AMR, paramedic, and EMT, and a Baystate Health critical care transport nurse. Dr. Zozula is the medical director under the Division of Prehospital and Disaster Medicine, and what those nurses will be doing while they're not doing transport is sort of the 911 system for the hospital, which is our rapid response team. So even when they're not doing transport, they will be around the hospital going to where acuity is, to where the need is. You know, if the ER is getting hammered, we'll send them down there. You know, if there's a code happening on whatever floor, they'll go there. You know, if you've got a really sick patient that's coming out of the ICU that needs a CT, then they'll probably help move that patient. So stuff like that. It's a kind of internal and external response. And there will be plenty of room in the ground ambulance. It's a 4-door F550 with enough seats in the back. So you could certainly easily be part of that.
What other questions do you guys have? You can keep putting them in the chat, but I think there's a few of us on here that you are welcome to go ahead and turn your mics on.
Hi, good to see you, Dr. Lutfi, again. I wanted to introduce myself. My name's Amit Bukai. I'm from Indianapolis, so not from Massachusetts, but I like the Northeast region. I did my master's in disaster management in Tel Aviv University in Israel. And so disaster medicine is something that I'm planning to pursue probably as a fellowship. And I also have a history as an EMT since 2012. I was wondering though, there are about, I think, 13 programs in the country that have disaster medicine only fellowships versus EMS/disaster. What would you say your program, like percentage-wise, allows for not only the residents, but even during fellowship opportunities for, you know, furthering their experiences in disaster training in addition to EMS?
So I'm going to start this, and if anybody else wants to jump in, feel free. So the disaster stuff is absolutely part of a requirement, actually, for the ACGME for the residency, and the same with the fellowship. Some of the ties that you're talking about, you know, practical experience, absolutely. We don't offer a disaster, or won't be offering a disaster medicine fellowship here. But if you've got ties with some of the federal agencies, that is something you could do. Did you say you've done some time in Israel? Is that correct?
Yeah, I'm actually a student at the Technion in Haifa. I stayed on there after doing my graduate studies at Tel Aviv. So if you know, I don't know any of my faculty from Tel Aviv University.
Yeah, so I've talked with Colonel Ashkenazi from over there. He's outstanding.
Oh, cool.
You guys know how to do it well. That's,
yeah,
I'm not blowing smoke. You're one of the ones that we use as a model. Absolutely.
That's why I really wanted to go study actually the program, the graduate program there, because I was like, where else? And I actually had the opportunity to go to IPRED, if you know what that is, this past January, the big conference, which was really, really great, and a great opportunity for networking. And that's kind of what opened the door for me for kind of realizing that I can continue to, you know, incorporate my two passions. So.
Oh, absolutely. If you get a chance, if you're from the States and you can get involved in one of those federal teams, they are always looking for people to do stuff internationally, and it depends on how much time you can get off. The TCCT, which is the team I'm on, that we were actually asked if we wanted to go back to Haiti and some of the ongoing missions that are happening. And they actually tried to call us up recently for something that happened in Turkey. So you want to get involved in those. And if you're looking at, for instance, a disaster fellowship only, it sounds like you're getting a lot of that training where you're at anyways. I would just pass along, make sure you get some practical experience as well. I've had some folks that I've talked to who've done research with disaster, but no hands, feet on the ground kind of stuff. And there's an element missing if you haven't done it before. And so there's an operational deficit, if you will. So when you're trying to talk about stuff to people who've actually done it and you're talking theoretical versus having done it before, it's nice to have the boots on the ground. So absolutely, I think you're in a great place because that you've set the model on a whole bunch of stuff, even preparedness. The U.S. could learn a lot from that. And even how you respond to what do you call it, terrorism. The way you respond is actually very rapid. And again, resilience is really emphasized over there. So I've been impressed when you have people hitting the air raid siren and expect people to hit the bunker in 90 seconds, civilians, that's pretty darn good.
Yeah, it's definitely a lot of experiences that I hope to bring to whatever program I come to. And I definitely agree with you. I think that I've seen a lot of programs that are very research heavy in terms of their disaster fellowships. And I do agree that like operational and like actual drills and working and getting the experience on teams. And that was actually a follow-up question of mine regarding international disaster work. And do you guys do any like partnerships with other EMS around the world in trainings or things like that?
We have in the past. I believe we did some stuff with Romania. I believe that's kind of fallen off by the wayside. If there's an interest, I've got some contacts in the Philippines and a couple of Asian countries. I think there's a couple other folks in our department that may have contacts. It would be something that we'd probably have to set up. I think those hooks that were there before haven't been used in a couple of years. But it's not something we're actively doing right now, just to be upfront as well, but it's something that could be set up. I think it is of interest for some folks, but right now the focus for the fellowship is to kind of work internally here. But for disaster stuff, there's absolutely lots of good programs out there. Doctors Without Borders, one of the trauma surgeons I worked with, she spends 6 months, I think it's a minimum 6 months that you have to be able to donate. She does that and then spends 6 months in Hawaii for her full-time job, going back and forth between the two. So if you want, just note my email, let's get in contact, and I'll be happy to connect you with some people as well.
Yeah, and certainly in the past, obviously, in global health, as with, some blurring into disaster, Haiti, Mexico City, and Romania were the sort of big spots that we have the greatest connections with. But obviously, COVID has unfortunately sort of destroyed all of those experiences for the foreseeable future and for the last year or so. So I'm sorry.
Right. No, yeah. No, it's really great to hear. I really appreciate it. And I hope to be in touch.
And agree, Matt just put across in the chat, as far as I know, the disaster solo programs, those are non-ACG
right.
approved. And I think some programs, and I don't blame them, are choosing that as a way of, one, having a good program and they have connections in those areas and can get you that experience. But they also don't have to go through the ACGME process.
Could we jump back to Seth Kelly while he's not on a call? Seth, we tried to grab you earlier, but we weren't able to make contact. Looks like you're back in the car for a moment. You want to kind of just introduce who you are, what you're about, before we lose you?
Sure. Hey, everybody. Can you hear me? Yes? Okay. So I'm Seth Kelly. I am happy to be joining the faculty in July. I'm currently in the middle of my EMS fellowship at University of Pittsburgh. And so first of all, I apologize if I couldn't figure out the mute on my phone. I usually do Zoom meetings from my computer, but if my radio was over people, I apologize. So I first became an EMT in 1995 and have been involved in EMS since then, primarily in a combination fire rescue EMS system down in Montgomery County, Maryland, just outside DC. Have worked in the business world in and around emergency services prior to going back to medical school. I did medical school at Texas A&M, lived in Austin for a number of years, doing healthcare consulting as well. And then I just finished my residency in July at University of Maryland in shock trauma in Baltimore. And I have family in Massachusetts. My parents grew up in Pittsfield, Massachusetts, in Western Mass, and so and I grew up just around the Boston area. So I'm pretty excited to be joining at Baystate, and look forward to hopefully meeting a lot of you on the call today. So.
We've got a couple minutes left if there are any burning questions. Awesome. Well, thank you guys all for joining in. It was really great to have you with us. And I think my favorite part about this is that we have had multiple people driving and or responding to sick patients pre-hospitally while on the call. We don't always get that on our Zoom meetings. It was really great to have you guys with us. You have the info for the division. Really, we enjoy talking to people and getting to know people around the country and around the world. So feel free to email if you do have some questions, or you want to just talk through what you're thinking and where you're thinking of and what you want to sort of be asking and looking at to better discern. Obviously, there's a ton of programs, and this is a tough year because you don't get to meet everybody. But I hope this helps you sort of have an idea of what we do here, but also give you some ideas of what you want to be asking and thinking about as you look at programs throughout the country.
So, and just to emphasize that, even if you're not considering Baystate, stay in touch. It's a small world, EMS especially, and disaster even more so. We all know each other. So if I can connect you with anybody, happy to do so. I think anybody else on this call, Seth, Kelly, Alex Zozula, Matt Goebel, Sam Broder, all those folks, Nate Stanaway, Aaron Marked. Even if you're not considering Baystate, we'd be happy to talk to you and try to give you some ideas, because at the end of the day, we may be calling you someday down the road asking for some information. It's a small world. We help each other out. So please don't hesitate to reach out. And Nate, if you don't mind posting my cell phone number, I owe you $1.
I see that you don't trust me to do that, Wook.
I wasn't sure you had my cell phone number, actually.
The secret. I don't always tell you what I know about everybody. Excellent. Well, it was really great to have you guys with us. Thank you for coming and joining us, and we look forward to getting to know you in the future.
Thank you.
Thank you.
Thank you.